hosted by the Statistical Methods group within DISHI. And we're trying to find industry and academic experts and have talks about the actual technological aspects of this problem and how we can discuss the methods to really move this area forward in an equitable way. We're open for more people to join us, especially in the Slack channel, and come talk to us to whatever work you have that is relevant to this, or if you're just interested, same thing. We have these monthly webinars that are very interesting and cover a broad range of topics. We also have a fortnightly reading group that covers academic papers mainly. And we are currently also conducting a field landscaping in which we're trying to get a grasp on who is working in this area, what they're working on, and how we can connect them. So if this could be useful to you, or if you have some input on that, please come join us via the Slack invite. We will be sending out a survey regarding this very, very soon. So please join this. And now for our talk. Today, we have the pleasure of having Dr. Joshua R. Loftus with us. He is an assistant professor at LSE, and he will be talking about his interest of using machine learning and data science to reduce the impact of social bias specifically. A bit of background on Joshua before you can start with your talk. Before joining LSE, Joshua earned his PhD in statistics at Stanford University. He was a research fellow at the Alan Turing Institute, affiliated with the University of Cambridge, and then was an assistant professor at New York University from 2017 to 2020. And Joshua's research interests involve improving practices in data science and machine learning to reduce the impact of bias, particularly biases associated with social norms and scientific reproducibility. This includes developing methods and software for statistical inference after model selection and using causality to analyze the fairness and interpretability of algorithms in machine learning and artificial intelligence. More broadly, he's interested in high-dimensional statistics and causal inference, and in teaching theory, applications, and best practices in data science using the R statistical programming language. So definitely very, very relevant for us, and we are very excited to have him today. And I'm going to give over to you now, Joshua.
All right, thank you very much. I appreciate the invitation to come speak with you, and I appreciate your attention from the audience. And I hope that you will find this talk useful and interesting. And particularly, I hope that you'll find it useful because I think that the interest of this group in health equity is a very important thing that I would like to see meaningful progress on. Okay. So let me start by giving recognition to my collaborators. I've had the privilege really of working with some really excellent researchers who deserve the credit for all the stuff that's good in what you're about to see. And in this talk, I'll probably spend most of the time talking about fairness at the beginning. This is, I think, most clearly connected to health equity. So fairness and equity are very, related concepts. And to start kind of historically with my own story of how I got interested in this area professionally, how I started working in it as a statistician. It happened during my time at the Alan Turing Institute. So during that year, there was this book by Cathy O'Neill that came out called Weapons of Math Destruction. A lot of people who worked in quantitative fields were talking about this book at the time. It generated a lot of interest. And there was also this series from ProPublica called Machine Bias, where this investigative journalist agency did several reports where they did some pretty rigorous data journalism, and they studied the use of certain kinds of algorithms in some very impactful social settings, like this example of criminal legal system risk prediction algorithm. And you can see the high level takeaway of that report. It was that this algorithm gives risk scores to people that seem to be unfair in a certain sense. In that sense was that for the people who had risk scores and who were Black, and who had been given a high risk, a lower proportion of them actually ended up being reoffenders compared to people who were not Black, and had a similar risk score from the algorithm. So a lot of people started paying more attention to this issue, that algorithms were starting to be used in some very impactful and significant settings by very powerful institutions. Large companies and governments were using them to make decisions that could really affect people's lives, and and really consequential kinds of decisions. So before I start talking about causality, though, I want to mention another example of an algorithm, just to relate this more closely to health equity, because this is an example a little bit more recent, but it shows that algorithms are being used in health contexts in ways that are also very impactful. So in this paper, the authors studied again, a risk prediction algorithm. This algorithm is actually being used by certain hospital networks, and it assigns a risk score to different patients. And then based on that risk score, the hospitals may decide to direct some more attention and resources. And ultimately, that a patient with a higher risk score may be given more care. And what the authors of this paper found when they studied the risk scores, and they broke down the risk scores by different groups according to race, they found that at the same level of risk, if they looked at the patients who were white and had been given a certain risk score, and then they looked at the patients who were Black and had the same risk score, and then they compared the number of chronic active health conditions that those patients had, then the Black patients had more chronic conditions than the white patients. So another way of saying this finding is that it seems as though the Black patients were being given lower risk scores if they were at the same level of number of chronic conditions. In other words, the attention and resources being allocated on the basis of these risk scores may have been allocated unfairly. You might have a patient who is Black, who has a high number of active chronic conditions, someone who really does need to receive more care, but this algorithm predicts that they have a lower risk score. And we may not immediately understand why that happens. When we first observe this result, we just see this is how this algorithm is behaving. In this paper, they did analyze why is this the case? So why did this happen? Why is there this disparity on the basis of race? And it appears to be related to just the training data for this algorithm. So the algorithm was trained on historical healthcare records, and you can you can imagine that people who have less resources, they have less access to healthcare. They might go in to receive healthcare less often, for the same kind of condition. If they have the same severity of a condition, someone with less resources may be less likely to go in and get help for that condition. And so this past training data that the algorithm was trained on picks up on this pattern, on the fact that some people have less access to healthcare. And then the risk scores are predicted using the previous healthcare utilization. So people who had accessed healthcare less in the past were being predicted to have lower risk. And it's not necessarily because they were in better health. It could be because they had less healthcare access in the past. So this is an example of an algorithmic system that has a very high impact. It uses some complicated machine learning tools. It's, some sort of proprietary algorithm, and it could be designed by people who have really good intentions. It could be designed by hospitals who are trying to do the best they can with the resources they have. And if the designers aren't careful, they might not realize that there is this important causal connection, this causal relationship in the world between a person's, say, socioeconomic status and their previous access to healthcare, and that relationship in the world could be some sort of unfairness in the training data. And then once you've trained an algorithm on that data, the algorithm could just learn unfair patterns and then start automating predictions using those unfair patterns, and basically automate an unfair system. Okay. So these were two kind of high profile examples about algorithms being used in situations where they really affect people, and the results really might be unfair. And we might not all have the same conclusion about whether or not it's fair or why it's unfair. There's definitely some plurality of different views about fairness, but these examples, I think a lot of people looked at them and thought there does seem to be something troubling about this example. We would like to understand it more, and we'd like to figure out, in general, what does it mean to say an algorithm is fair or not, and how can we make algorithms fair? And to give one last indication of the sort of a big problem this is, the really large, very profitable tech companies that are leading the charge and using algorithms have actually given, in their shareholder reports to their investors, they've given warnings saying that we have these new products, these new algorithms, and as an investor in our company, you should be aware of the fact that our company is facing some risks due to these new products. We don't really necessarily understand how they work or what will happen when we use them. It's possible that, for example, some data journalists will find out that an algorithm that we've deployed has some negative social consequences, and that could do some harm to our brand or something like that. So these are big, very, very wealthy, powerful companies informing their investors that they think there is a potential significant risk to their share value due to the possibilities that algorithms are doing things that we don't understand, that we don't want, and someone will find out, and when they find out, there will be a controversy. Potentially, the company will have to do something to fix the problem and might bear some costs. So this is in other words, this is an impactful problem. Okay, so as people were starting to pay attention to these examples, and more people were starting to do some research about fairness of algorithms, when I got into this area, I got into it with this basic intuition. I started off with just this basic intuition that it seems to me as though figuring out whether an algorithm is fair is a similar problem to learning about causal relationships. So I had studied statistics and things like regression models and various kinds of models that relate multiple variables to each other. And one of the first things that we learn, that we even teach in introductory statistics courses, if we're good at teaching those courses, is that there's a difference between observing associations between variables and knowing that there's an actual causal relationship, right? So we probably have heard the phrase, correlation is not causation. So the point here is that there is some subtlety in understanding whether a relationship between variables is causal, and that subtlety involves potentially controlling for other variables while trying to understand the relationship. And I thought that there's basically a similar structure to the problem of understanding whether an algorithm is fair. So I wanted to use causal models to try to understand whether algorithms are fair. That was the first my stepping point, entry point into this direction. But before we can do this, we might think, especially if we've learned some more previous statistical method wisdom about causality, we might wonder, how can we do experiments? Because those are like the gold standard for understanding causality. And in fact, the statistician Paul Holland said we shouldn't even talk about causation unless we can do some manipulation. So unless we can do an experiment to actually change a variable, then it doesn't make sense to think about that variable being a cause of things. We could call this Holland's rule, or no causation without manipulation. And it is a rule that some people do follow carefully. I think it's useful to know about because it's helpful. It can help focus our attention on the things that we actually can manipulate, which is a very practical way to focus our attention. But I personally don't follow this rule very strictly myself. I'm a bit more open-minded about allowing kind of thought experiments where we can't actually do the real experiment. But if we start from this point, it's a useful place to start because it does focus our attention, and it does focus it on things that are very concrete and actionable. So let's think about, if we wanted to understand if an algorithm was fair on the basis of some sort of attribute like a person's race, for example, then we could ask, what could we possibly manipulate in this setting where an algorithm has a bunch of data about someone, it's going to make a decision about them, and we want to know if that decision is fair on the basis of something like race. So we couldn't do an experiment where we change a person's race. That's not really feasible, but we could change the perception of a person's race if the algorithm or the decision process involves a human decision maker. So then this perception matters. There's someone who's seeing the data about a candidate and then making a decision about them. So this is a paper that used this fact, and what it did in the experiment in this paper is they had a bunch of resumes, and the resumes were basically identical in content except for the name on the resume. So this is the thing that could be randomized, could be manipulated, the perception of a person's race based on the name at the top of the resume. So there are names that are correlated with different racial groups, and someone reading the resume might infer a person's race from the name. And so that's what these experimenters used to find out if there is some sort of racial bias in the job market among employers. And they found, yes, there's systematic discrimination. These resumes, again, the resumes have basically the same content except for the name, but the callback rate or the response rate to resumes was much higher if their name was one that sounded like a white person's name. So this is an actual randomized controlled experiment. And so we've on the one hand, we've got something like it reaches our sort of our highest standards for evidence. We've got an experiment. But on the other hand, there's something a little unsatisfying about it, for me at least, because this perception of a particular variable, like race, at the last minute, like right before the decision is made, it's a very kind of weak way of checking for unfairness in a process that might have been going on for a long time. Okay, so what do I mean by that? Let me skip this and talk about another example. So this is another very famous example, and it's similar. It's also about discrimination, and you may be familiar with it. It was about graduate school admissions at Berkeley, where across the whole university there was a lower rate of admission to applicants who are women. There was a higher rate of admission to applicants who were men. But if you looked at each department in the university separately and you saw the admissions committees in that department, what decisions were they making, then this previous discriminatory pattern that I described just disappeared. Individual departments did not seem to be discriminating on the basis of gender. And so this is a famous example used to illustrate Simpson's paradox, where you have this correlation at one level of aggregation that disappears or reverses at another level. So across the whole university, there is a correlation between gender and application or admissions, but within each department, there wasn't this correlation. So let's think about this example and also consider this same kind of idea about, say, randomizing the perception of the candidate at the last minute, like right when they're being evaluated by an admissions committee. So I want to think about a process here, and I'm drawing this process in a graph where I've got variables and arrows, and I'm sort of thinking about a causal story where something's happening over time going in the direction of the arrows. So I can just take this as a thought experiment and imagine that someone based on their gender may have a different experience of socialization and a different experience in the educational system. And because of that, when they're in university, they may make different choices about what to study, what subjects to major in. And then because of that, they may apply to a different department for graduate studies, and those different departments had different admissions rates. So this is what I've done here is I've given a sort of causal story to explain the process of the Berkeley graduate admissions example. There were different rates of application of admission depending on which department someone applied to, and it turned out that students who were applying to graduate programs who were women, they were applying to the more competitive graduate programs, the ones that were more difficult to get into at higher rates. And that's why women had lower acceptance rates overall across the university. Okay, to connect this to our previous example, we could imagine that the admissions committees could have resumes that could be blinded for gender. You could, for example, remove names and remove any kind of indication from the resume, from the application of the person's gender. And that wouldn't have done anything to change this overall gender imbalance across the whole university, because the disparity began somewhere earlier in this process, before that perception at the last step. So the contrast between this example and the previous one is to show that if we focus on things that we can manipulate, usually these are things that are much later on in the process, like closer to the decision time, and usually these are things like just the perception of a person's sensitive attribute, rather than things that we can't really change about them. Like we couldn't do an experiment where we changed someone's race and saw how their entire life course would be different. So to conclude these two examples, my point is if we do focus on what we can manipulate, that may help us understand like what things we can change right now. For example, we could have an application process that's blinded so that the people deciding which candidates are admitted don't know the gender or the race of the candidates. That's something we could do right now. But if we put this limitation on ourselves, if we say we're not going to talk about causation unless we can manipulate something, then we may miss on we may miss the fact that there's some sources of unfairness that happen earlier on in a process before we can do an intervention. And I like models like this for making that very concrete. Even though this is a sort of toy model, I just made this model up. I didn't consult a large amount of literature or use a data set to learn this model. I just made up some variable names and wrote it down to tell a story. I think that it's useful for that purpose. I think writing this model down and telling this story helps me understand the way that I think about fairness for this application. And this is also an example of a type of causal model that I want to use several more times throughout the talk, so I should explain a little more detail about how we can use a causal model like this. So this is a graph, and it doesn't have any cycles in it, so we call it a directed acyclic graph, or DAG. And DAGs are a useful kind of notation for talking about causal models. The idea being that you see an arrow pointing from one variable to another if the first one is a cause of the second one. And that is a sort of one level of causal modeling that we could use. And it shows us relationships structurally. And I think one of the useful things about DAGs is that they're very easy to look at and understand qualitatively the kind of relationships that are going on. We can combine a DAG with some additional level of modeling if we also know specific functions for each variable that tell us how that variable depends on the inputs. So for example, the variable major here, it has two variables that are direct causes of it, socialization and education. And I might assume that I actually know a function that tells me the probability that people will choose a particular major depending on their socialization and education. So if I knew what their educational background was like and what sort of socialization experience they'd had in the course of their life, this function would tell me how to compute the probability that they would pick a particular major. So if I assume that I know these functions, we call this a structural causal model, or SCM. A structural causal model is a very powerful type of model. It's very difficult to learn. You can think of it as having the maximum amount of information you could possibly have about the phenomenon you're studying. If you have a structural causal model, you understand basically everything there is to know about the causal relationships between all of the variables and any kind of causal question that you could ask about them. So it is a very big assumption to say we have a structural causal model. But because they're very powerful as models, we can also use them as tools. All right. I think I want to postpone this slide. Let me come back to it at the end if we have time. So there's a few points about the ways that algorithms can be unfair. And I think that a couple of these are quite relevant for the healthcare setting. In the example that we saw where the health risk algorithm was using previous healthcare utilization as the outcome variable that it was predicting, that was an example of using a proxy for the variable that you really care about. So it's really often the case that the real outcome that we care about is not something that we measure directly. We instead have some kind of other variable that's like the next best thing we could get for it. So an actual healthcare risk prediction algorithm it ideally would predict the risks of having adverse health events of individual patients. So it would be predicting their actual health outcomes, not whether or not they've been getting healthcare, receiving healthcare. So receiving healthcare is not the same as actually having a health problem. So many algorithms have this same problem, that there's the variable that they're focused on is not actually the variable we care about. So this is one of the really big, very recurrent problems in algorithmic applications. And so it's one of these things we need to always remember as a limitation. Another one is sampling bias. I think this relates to the first one. It could be that the data that the algorithm is trained on doesn't actually look like the full population that you really want to study or to provide healthcare to. And that could be, again, like because of access to healthcare. And even more troubling than that, it could be related to different survival rates as well. So you could have attrition where some people are not in your data set because they've actually already died because the healthcare they've been receiving was so poor. So if you have training data like that, and you train algorithms on that data to learn about healthcare risks and to predict healthcare risks, there could just be people missing from your data set for various reasons. That's another really important limitation that we should always remember. And then this last point is the one that I'll come back to if we have time, where I want to mention this other example on slide number 12. All right, so I'm going to move on and come back to slide 12 later if we have time. So we now have a bit of a framework for talking about causality, and we can start thinking about testing out different ideas for what it would mean for an algorithm to be fair. And one idea, perhaps the simplest and most straightforward and easiest to check or to implement, is this idea that the algorithm just does not explicitly use a given variable. So we might think this algorithm is fair, it doesn't discriminate on the basis of race, if the algorithm just does not have race as one of its input variables. For example, you may not even have race in the data set. And this is actually one pretty common approach that some institutions and governments take. They'll say, we're just not going to ask for what people's race or gender, we're just not going to ask in the first place. Therefore, that information won't be in our data set, and we can't be accused of discriminating or being unfair because we didn't even have that information. So this is one notion of fairness or unfairness. And I think that with this causal modeling framework and idea, we can understand the limitation of that notion. So for example, you could have an algorithm, suppose this is a toy model to go along with the criminal risk prediction example. And you could suppose that the algorithm only takes as an input the number of prior convictions, or whether or not someone has a prior conviction. So P is prior convictions. And suppose that this DAG here describes the way the world is working. So suppose that whether someone is arrested for, say, marijuana possession depends on things like some structural racism factors, like it could be based on the fact that where someone lives is a a place that has much higher policing rates than someone else. And so whether or not someone is arrested for a marijuana possession is a cause of whether they have a prior conviction, because they might be convicted on the basis of that arrest. Structural racism might also change the conviction rates as well. In fact, there's research that suggests that there are racial disparities both at basically at every step of the criminal legal system, arrest rates, conviction rates, and so on. So by the time we get to an algorithm that's just using prior convictions, in the real world, because we have this causal model here, this causal model tells us that prior convictions is a consequence of racism and race. Like, these are important inputs into this variable P. So if a risk prediction algorithm doesn't use the variable R, it just uses P, there is still a very strong sense in which that algorithm depends causally on race, right? The causal model tells us that P depends on R, the algorithm depends on P, and so even though the algorithm is not using P explicitly, it still depends on, or it's not using R explicitly, it still depends on R. Okay, so I talked through this example as a way of seeing how causal models can help us potentially understand the limits of a particular idea about fairness. What I want to give as the takeaway message for this, though, is not that any one causal model is the right one, or any one definition of fairness is the right one, but rather that we can use causal models as tools to try to probe the limits of an idea about fairness. All right. And one more takeaway that I want to have about fairness is, I think it's useful, for me it's useful to the way there are actually like dozens of other definitions of fairness, and I'm not going to go through all of them, but one way that I organize these in my head and try to make sense out of them is through an idea about depth, and trying to think of at which point in this ongoing process of history are we trying to set like a barrier and say anything after this point we want to make fair, and if it happened before this point we can't change it. So focusing on the perception of a sensitive attribute at the time of the decision, that's a very shallow notion of fairness. We're not looking back further in time into the ways that a person's life was affected before that last stage. But these causal models, they allow us to think about how those earlier stages depended and could have been different in another counterfactual world. And so they allow us to think about what deeper ideas of fairness might imply. I'm going to need to move a little more quickly now, I think, to try to get to some more interesting things. So all I want you to take away from this slide is just that we do have a mathematical framework that says if you have a DAG, then you can come up with definitions of fairness from that DAG. So we don't only use them as ways of critiquing other definitions of fairness, we can also say there is a definition of fairness that corresponds to this DAG. And that definition is, well, we want to do this thought experiment that I mentioned earlier. For a given person, we want to think, how would this person's life be different if they had had a different sensitive attribute value? So how would my trajectory through the educational system in academia, how could that have possibly been different if I had had a different gender? Not at the stage that I'm applying to a job right now, but earlier on through my whole life. Like all of the other variables in the whatever algorithm there is that's predicting my hiring or educational outcome, how could all of them possibly have been different as well if I had had a different value of a sensitive attribute? That's a big thought experiment. And a structural causal model is a powerful mathematical model to allow us to quantitatively go forward with that thought experiment. And then we could say, all right, there's me, the observed value of Josh, and then there's a counterfactual Josh in this other world. And that counterfactual version of me has, maybe some different, their transcript looks different. They studied some different classes, they got some different grades. And we could then ask if this algorithm is fair by checking whether it gives the same predictions for the actual me and the counterfactual me. So this is, in some sense, a very strong definition of fairness. And the other piece of information on the slide is if we have a DAG, that DAG can tell us a sufficient but not necessary condition for an algorithm to be fair. And that is the algorithm only uses variables which are not descendants of the sensitive attribute. So if that's true, then that algorithm will be counterfactually fair according to that DAG. Now that's not a necessary condition, but it is, I think, a rather unrealistic condition, because when I think about different fairness applications and examples of sensitive attributes, I think most people would say most of the time that sensitive attributes do influence the predictors, specifically because of the things like structural racism and other kinds of discrimination that have been happening. So I think in an actual application, it will be very rare to find predictor variables that have not been influenced by something like a person's gender or race or life experience, something so central to their life experience. So this condition, I think, doesn't actually tell us how to make algorithms fair. And in fact, this is one of my high-level takeaways about algorithmic fairness. In some sense, I would say this is an impossibility theorem by itself. And it may sound surprising because I'm proposing this as a definition of fairness, and often when someone is proposing something, they kind of want everyone to adopt it and start using it. What I'm saying now is that I think this is basically impossible in almost any application. So I'm proposing a definition of fairness, and I'm also going to tell you I don't think it's achievable practically for any particular data set and algorithm. There's just not going to be signal in those variables that's not been influenced by a sensitive attribute. But I have to be honest with you, that's my conclusion. It's not a very good way to sell my research, but I just think the truth is fairness is really hard. It's not easy to just tweak an algorithm a little bit and suddenly we've achieved fairness. On the other end, though, I think I've gone from one extreme to another, where I started by talking about perception of a sensitive attribute at the very end stage. And this is now, in some sense, a much deeper notion of fairness. It says, suppose this person's entire life course had been different, and we want our algorithm to give the same output for them. So we could then now start thinking about things in between these two extremes. So the most shallow version of fairness and the most deep version of fairness for a given person's life period, we could think about something in between, and there might be some things that are practically achievable in between. All right, let me quickly wrap up so there's some time for questions. I'll tell you very, very quickly the high-level takeaways of the rest of the slides. One of them is that we can talk about path-specific versions of fairness when we have more complicated DAGs with more pathways in them. We can try to block some of those pathways, say this pathway is unfair, but this other one is necessary to use, so we can't block it. That's one way that we could start getting something that's in between the two extremes. I'll skip the stuff about impossibility theorems. Another thing that I do want to mention really quickly, because whenever we're writing DAGs down, there's generally this concern that whenever we've written one down, it's wrong. I just always have to have a reminder about this quote from George Box that all models are wrong, but some are useful. And our goal is not to obtain a correct model by excessively elaborating it. It's to have a model that captures the things that are the most important for that application, and then to be aware of what's most importantly wrong about that model. We can also use causal models if we have multiple sensitive attributes and multiple pathways to start analyzing intersectional fairness in this formal and rigorous way that allows for describing things like different sensitive attributes having different causal effects through the same pathways, and trying to think about disentangling these different pathways. So this is just an area where things can get very complicated once we start having lots of different pathways through a DAG. And my first high-level takeaway from this is that intersectional fairness is also a very, very complicated and hard problem, just like causality is very complicated and hard. And then the last thing I want to say, the takeaway about interpretability, it's that we now have all of these sophisticated tools that are not like linear regression, where we could understand the model very easily. We have deep neural networks and all of these things that seem to be very opaque. We call them black box models because we don't understand how the model depends formally on a given predictor variable. But we also have these new tools for model interpretation. So this is a growing area, active area of research right now, explainable AI, interpretable machine learning, where people are making tools to try to understand how a model works, how a model depends on a given input variable. This is related to fairness because we could imagine using these tools to think about how a model depends on a sensitive attribute as the particular input variable that we're focusing on. And in this model-agnostic or black box setting, we often only access the input-output interface. So we can change what is being input into the model and then see what it outputs, but we don't know how things are working inside. So a lot of the tools for interpretability just make use of this fact. They just change the inputs in different ways. They look at how the outputs of the model changes, and then they do things like, say, plot them. But there's a problem, there's a fundamental limitation to all of these interpretability tools, which is the same fundamental limitation. They inherit the same limitation that just simple regression coefficients have, which is that what we mean by the word depend when we say, how does the model depend on this variable, is a subtle issue. Right? If I look at the coefficient of a predictor variable in a linear model, in some sense, the model depends on that variable in a simple way, just through that one coefficient. But in another sense, I have to remember that in the real world, that variable could be causally related to other things. So interpreting these IML and XAI tools are by default going to have the same limitations as looking at regression coefficients. We can't take their output and read it as a causal conclusion by default. But that's what my most recent work is about. There's a preprint that you can read more on if you're interested. And I would be really glad to have any kind of questions or comments from that work offline in the future or now. So I'll just stop here. Thank you.
Thank you so much, Joshua. And very well done in keeping the time. I'm impressed.
Well, I'm happy to stay around however long people have questions for. If you want to end the recording, or if people want to leave or anything like that, I understand.
Definitely. I'm just going to say a few things. I am going to stop the recording here. If I find out where.